Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
Welcome back to the Federal Drive with Terry Gerton on Federal News Network. Rural communities voted in large numbers for President Trump in hopes his administration could boost their fortunes. However, his first major piece of legislation not only doesn't help these communities, it may actively harm them. Here with more insight into the unspoken impacts of many of the bill's provisions is the chief economist at the Center on Budget and Policy Priorities, Dr. Gbenga Ajilore. Dr. Ajilore, thank you for joining me in studio today.
Thank you for having me.
We have a really important topic to talk about, but before we jump into it, I want to ask you to help us understand definitionally the difference between rural and urban communities, especially from a social policy perspective. What are the key things that you think about in this space?
That is a great question. There's one of the things about rural versus urban is that there are a lot of definitions of rural communities. In fact, there's technically about 12 to 15 definitions. And so the way to think about rural and urban communities is that it's about, population and population density, basically. Places that are small towns, and sometimes it can be close to metro areas, sometimes it can be further away. The other thing that's important to remember is that every state in the nation and territories have rural communities. So when you talk about rural America, it's almost a misnomer because you could be talking about rural Alabama, you could be talking about rural New York, even rural California. And what I always like to talk about is like even rural California, you have the Central Valley and you have Northern California. So the important thing about rural communities is that they're very diverse and also very vibrant. And so that's the kind of important thing to first think about when talking about rural communities.
So when we're thinking about policies, we can't just say rural communities and paint them all with the same brush.
No, and we do that a lot, especially when it comes to agriculture. We think about agriculture and rural as synonymous. And while a lot of agriculture is in rural communities, it's not the lead industry. And so you think about manufacturing, you think about mining. In fact, the service sector is the highest employer in a lot of rural communities.
That's a really great reminder. And so when we start to think about the big, beautiful bill, the reconciliation bill that's making its way through Congress, you've made the case that rural communities are going to be significantly and adversely affected by many of the provisions in this bill. Let's take the one that gets, I think, the most attention, Medicaid. What is it about the provisions in the bill around Medicaid that have you most concerned for rural communities?
I think the best way to start is thinking about persistent poverty communities. And so persistently poverty communities are defined as having unemployment rates of 20% or more over the last 30 years. And 86% of persistent poverty counties are in rural communities. And so when you think about people who are going to need Medicaid are going to be primarily in rural areas. And so that's one of the concerns is that a lot of people who are going to use Medicaid are probably going to be in rural areas. The other part is that Medicaid is vital for the financial viability of rural hospitals. And so when you cut Medicaid, that's going to impact the viability of rural hospitals, and we're going to see an increased risk of closures.
So we're already seeing that many rural communities are described as medical deserts, right?
Very much so, because over the last 20 years, we've seen so many of these rural hospitals close. And even the hospitals that didn't close, they've lost essential services like OBGYN. And so when you have that, you end up having this doom loop of people not moving to rural areas because they don't have the hospital services. And then because they don't have the hospital services, those hospitals aren't viable. But then when we had Medicaid expansion, that really helped out and really mitigated these issues. And so now with this one beautiful bill, it's going to increase that risk of closures.
So Medicaid's gone through a number of changes over the last decade or so with the Affordable Care Act and Medicaid expansion, and then states choosing to participate in Medicaid augmentation or not. How have hospitals adjusted to all of those different variabilities?
So one of the things that's really helped with the expansion is that that's the biggest key in terms of hospital viability are uncompensated care costs. Just because someone doesn't have insurance doesn't mean they're not going to get health care. When you break your leg, if you have a heart attack, if you're pregnant, you're going to use hospital services. if you don't have insurance, then that the burden of that goes onto the hospital. So studies have shown that in states that have Medicaid expansion, uncompensated care costs are 3% of overall operating expenses. In states that did not, it's over double that at 7%. In fact, in Louisiana in 2016, they expanded Medicaid. The share of uncompensated care costs dropped 55% after they expanded Medicaid. Wow. That's how important this is.
So I'm going to come back to Medicaid in a minute, but I want to take up another one of the big programs that's been addressed in the bill, which is SNAP, Supplemental Nutrition Assistance Program. And when you talk about persistent poverty communities, it seems to me that SNAP would be a crucial asset in those communities, and we're talking about making it smaller.
It is very vital, especially for children. And one of the problems with what's happening in the bill is that they're going to, I know we're going to address this a bit later, but talk about work requirements. There's work requirements already in SNAP, but what they're doing is they're expanding it to, before it was from ages 18 to 54. They're expanding that to now parents who have children above ages of 7, and then for individuals above 55 to 64. So expanding that work requirements. And so in rural areas, people ages 55 to 64 are more likely to be living in rural areas than in urban areas. So now you're expanding that, and what that's going to do is make it harder for people to be eligible for SNAP.
And those are the grandparents that are often caring for their grandchildren on a full-time basis while the parents are working.
Exactly.
Let's take on the work requirements issue, because it just seems to me if you're in a rural area where, as you already said, unemployment is higher, and those communities are more likely to need and take advantage of these programs like Medicaid and SNAP, how is adding a work requirement going to help people?
It is not going to help people because people want to work. It's difficult to find jobs. And even, especially in rural areas, you think about finding jobs, job availability, transportation to get jobs. There's, transportation issues in rural areas. And so when you have areas that have low probability for jobs, and then you add a work requirement, even when people are able to find jobs, these jobs are very volatile. So as I mentioned before, the service sector is the largest employment in rural areas, and the hours for those people are very volatile. So one month you may be able to make that 80 hours. Another month you might be at 75 hours and then get kicked off of Medicaid and SNAP.
And then every time you have to reapply.
Exactly, monthly.
So that's an incredible administrative burden as well as a logistical challenge.
Right. And that's how they're getting their cuts.
I'm speaking with Dr. Gbenga Ajilore. He's the chief economist at the Center on Budget and Policy Priorities. Okay, so we're trying to wrap our head around the math. Are there other provisions in this bill that should worry rural residents?
So one of the things that we didn't talk about is the tax side. And so one of the reasons why that the bill tries to cut so much from Medicaid and SNAP is that they're trying to pay for tax cuts, the extension of the 2017 tax law, but even tax provisions beyond that skew more towards the wealthy. And so you look at that, and there's actually a provision that would be helpful to rural places. So you look at the child tax credit, they expand that. But what ends up happening is that they didn't expand it. They don't make it refundable, which means people who have lower incomes who aren't able to get the max aren't going to get that full at one. So they increase it from $2,000 to $2,500. But most people in rural communities aren't going to be able to experience that. And so you're leaving, a total of 20 million children off of being able to benefit from the child tax credit.
And the reason families won't qualify for that tax credit?
Is because they don't make enough money. And so a lot of times if you have a tax credit where you don't make enough to get the full credit, if it's refundable, they'll pay the money back to you. But this is non-refundable. So if you get up to $1,800, that extra $700, you don't get it. But if you make over $200,000, over $500,000, you get a full $2,500 credit.
So it's another case where the pervasive poverty works against people actually receiving the benefit.
Exactly.
So when you think about these policy recommendations that are in the bill, what does the center offer as an alternative for policy?
I think we just have to start over. Think about, what is it that we want? So some of the things that you're looking at is you're pushing for a tax cut for wealthy people who are already doing well. And what we've seen over the last number of years, especially with persistent poverty county, I'm talking about 30 years, you want to lift up the bottom. So what are some of the things? You have these social policies that help out with Medicaid and SNAP. But then you also look at, the president talks about boosting domestic manufacturing. Well, let's do that. Let's, in the previous administration, they talked about the CHIPS and Science Act, which was look at biomanufacturing, look at nuclear, you look at future energy. And a lot of times these rural places are the places where you can do that. And so let's invest in the communities that we want not just cut taxes for wealthy and then cut spending.
And so some of those infrastructure projects are underway, but they haven't come to fruition yet.
That's true. And one of the concerns that earlier this year, a lot of these infrastructure projects, the funding for it was frozen. And so more recently, they're starting to release that. But that's the kind of things that we need to focus on, is investing in these communities and investing in the people in these communities.
They'll have a more immediate impact in lifting them up from poverty.
Yeah. And this way you'll have more jobs, you have more people, and you have a more sustainable pathway for prosperity.
What are you anticipating as the Senate takes up the bill?
I think I see more of the same. I mean, a lot of what I've seen over the last 2 days is that there's been discussions between the Senate leadership and the president, and really continuing to push this adverse way of, cutting spending and bearing the burden on the lowest income just to have tax cuts for the wealthy. And so one of the things that we haven't mentioned is the broader economic context, where we have this chaotic and haphazard tariff scheme, where we have 30% tariffs on China. We have 10% tariffs on all these countries. We have tariffs on steel and auto tariffs, which over the weekend were raised from 25% to 50%. What that does is going to increase prices for consumers. It also increases prices for businesses for their input costs. And put this together, that's going to increase the risk of recession. And so what we have is we have this elevated risk of recession, concerns about higher prices, and at the same time, we're going to be cutting Medicaid and SNAP just to pay for tax cuts on the wealthy.
I think what you're saying is we have a very inconsistent message around this package. We want growth, but we have taxes, which creates uncertainty, and that growth is instrumental in creating opportunities for the poor that we want to lift up, but at the same time, we're eliminating the safety net programs that would help them.
Exactly.
All right. Well, thank you for adding clarity to this discussion, and thank you for joining me in studio today.
It was a pleasure to be here. Thank you.
I've been speaking with Dr. Gbenga Ajilore. He's the chief economist at the Center on Budget and Policy Priorities. We'll post this interview at federalnewsnetwork.com/Federal Drive. Subscribe to the Federal Drive wherever you get your podcasts.